Are you her daughter? Are you her sister? Are you her friend? Are you her mother? Are you her neighbor? And nobody asked us, are you partners?
The inequities and injustices faced by members of the 2SLGBTQ+ community as they navigate coping with dementia is the focus of a new awareness campaign that highlights their real-life experiences.
I liken it to a journey to hell. There's no sugarcoating this. This is an incredibly awful disease.
Sharon Hunter's partner Stacy was officially diagnosed with dementia in November of 2020. Since then, maneuvering their way through Manitoba's healthcare system as a same-sex couple has been what she calls a nightmare.
We came out years and years ago, but having to navigate the healthcare system for dementia meant that I had to come out over and over again to caregivers. And then you're open and vulnerable because you don't know how people are going to respond. Are they going to now treat us differently?
Sharon feels heteronormativity is systemic in the healthcare system, and it often meant she wasn't invited to appointments with Stacy, which she believes had serious consequences.
Stacy was embarrassed about having dementia. She didn't want people to know about it, so she was very good at covering it up. And I think that led to a misdiagnosis. I think it only led to a partial diagnosis. She was initially diagnosed with primary progressive aphasia, which is definitely part of it. But I had to advocate for months after that to say, I think this is something more because she's paranoid and has delusions and heightened activity. And so I kept saying, I think she has Lewy body dementia.
With which Stacy was eventually diagnosed. Experiences like Sharon and Stacy's are at the heart of EGAL Canada's Help Us Remain campaign, with 10 participants sharing their stories. It is informed by a report the organisation published last year on the prevalence of dementia in the community.
Members of the 2SLGBTQI community are at 2 to 3 times higher risk of dementia because of cultural trauma, which is basically day-to-day discrimination.
Executive Director Helen Kennedy says the campaign also provides resources for caregivers and healthcare workers while imploring people to be more empathetic and advocating for representation.
We know traditionally and historically that our community members are never or rarely included in these conversations. And I think that we need to be included in every conversation because our needs are quite different.
Heterosexism, sexism, ageism, sizeism, racism, like all the isms are, have hate behind them. And I think what we don't acknowledge in our society is that hate is a health concern. It's probably the biggest health concern in the world. And I'm hoping that this campaign leads us to be able to act with love towards one another and caring.
To hear more stories like Sharon and Stacy's, an audio book compiling all of the experience of the campaign participants will be available for download from EGAL Canada very soon. For City News, I'm Dilshad Burman.